Imagine you're out to dinner at a restaurant with your family when you begin to hear a child throwing what you believe is a temper tantrum. At first you think to yourself, another bad child in need of better parenting. But then you notice that there's something different about this child. There's a repetitiveness in his speech and the way that he's banging on the table. And then, upon looking over your shoulder, you notice that he's not responding to the soothing of his mother and his father. It's at this point that you begin to think, maybe this isn't just another bad child, maybe this is an autistic child. The Center for Disease Control and Prevention estimated in March of 2012 that nearly 1 in 88 children born will have some form of autistic spectrum disorder, or ASD. Males are 4 times more likely than females to be born with ASD. As you can see, this is a great jump from 1975, when we believed that only 1 in 5,000 children was born with some form of ASD. As a mental health nurse, I've had the privilege to know a few autistic adults and their families. It's my experiences with them that have encouraged me to do further research into the disorder. Today I'm going to take you through the common signs of autism, the treatment that is available, and the current research that is being done. Let's start by talking about what exactly autism is and some of the early signs. The National Institute for Neurological Disorders describes autism as not simply as one specific disorder, but a varying spectrum of neurodevelopmental disorders. These are characterized by social impairments, communication difficulties, and restricted, repetitive, or stereotype patterns of behavior. On the spectrum, autistic disorder is considered the most severe, while Asperger's is the more mild form. So what are some of the early signs? By age 1, a child has not begun babbling or pointing. At age 16 months, no single words are spoken, or by age 2, no 2-word phrases are being said. The child does not respond to their name, demonstrates poor eye contact. It demonstrates excessive lining up of toys or objects such as cars and blocks, and does not smile or respond to social situations. There are also some later signs. The child may have an inability to make friends or sustain a conversation with peers or adults. Repetitive and unusual use of language is often noted. An inability to defer from a specific routine or ritual, and a preoccupation with a certain object or subject is also often noted. So now that we know a little bit about autism, what can be done? There is no cure for autism, however, there are many treatment options. Education is extremely important, especially in the beginning, for parents and the child affected. Individual and family therapy is beneficial to parents, caregivers, and siblings, and support groups are also available. There are programs available for autistic children. These programs are highly structured and go off of a program developed that is called Applied Behavioral Analysis. This focuses on reducing inappropriate behavior, increasing communication, learning, and appropriate social behavior. There is a high risk for programs with increased one-on-one time with teachers, typically 36 to 40 hours per week. And the most successful programs have predictable schedules, highly structured activities, break tasks into simple steps, and provide reinforcement of behavior. Does medication help? Medication is used to treat the symptoms of autism. For a child that has hyperactivity and impulse control, we often see medications such as Ritalin and Adderall, which are typically used for ADD. For children with severe behavioral problems, we can use antipsychotic medications. And since seizures are very common with ASD, you'll often see a child on some form of anticonvulsant therapy. So what kind of research is being done? We do know that there's no one specific cause for ASD. Previously, there was a theory that there was a link between vaccines and ASD. However, that has been discredited. Dr. Dennis Flaherty was the one that hypothesized this link. Numerous studies have been done, including a recent research at the University of Sydney, which studied 1.25 million cases and found no link between the vaccine and autism. There was another report released on May 29 of 2004 that states that it may be more of an environmental factor. We do know that men over the age of 40 and women over the age of 35 have a much greater increase of having a child with ASD. Because of this, they believe that there is a gene mutation already present in the DNA, and that environmental factors such as age, stress, and diet can all contribute to this gene mutation taking effect. So, we've talked about the major components of ASD, what it is, early indicators, treatment available, and current research. So, now what else can we do? We need to get involved. We have to stay up to date on our research. Helping raise money for groups that are currently researching the treatment and causes of ASD by either donating or helping with fundraisers is important. And just being available in the community to lend an open ear or a shoulder to cry on for a frustrated family member can make all the difference in the world. Remember that little boy I talked about in the beginning? Now that you know a little bit more about ASD, would you be so quick to label him as just another bad kid?